how consistently are you able to see quote unquote reversal? And what does that kind of mean in your opinion? Like what would be the definition of diabetes reversal?
Yeah, so definition would be that if you were to have something, say a refined and processed sugar of sorts, like a piece of cake, that you would have a normal glucose response and a normal insulin response to having that piece of cake. So most people are, there's something called the Kraft Test, which sort of measures the insulin response. That's very good, but not many clinicians do it. But many people are familiar with the oral glucose tolerance test. And that's where you have a certain amount of glucose and they measure your blood sugar before having it, 30, 60, 90, 120 minutes after. And they look to see sort of a normal response. And the idea is at the beginning, your baseline, your pre-glucose consumption blood sugar is fairly similar to the 2-hour mark. The 2-hour mark is expected to be a bit higher, but that you peak and that you come back down to within a relatively normal range, within 90 to 120 minutes. And that's what we're looking at. So we call it the postprandial, the after the meal blood sugar level. Now, if you're a diabetic, your blood sugar level is going to go way up and it's going to stay up for a very long period of time. So if you were to have something, some cake or some ice cream or the potato, and just have it on its own, then in a diabetic, we would see the glucose go way up and then take hours before it starts to come back down. And in a non-diabetic, we would see their sugar goes up in response to the sugar consumed, but then within that 90 to 120 minutes comes back down to a more normal range. And so we call it the glucose response curve. So, the definition to us is if you can have a normal glucose response as a non-diabetic would to having the same food. So if I were to have, kitty cup with ice cream versus, a non-diabetic, someone who had never been diagnosed with diabetes, unlike myself, when we eat, we'd expect to have the same curve rather than I have that little bit of ice cream and my blood sugar levels stay high for 4 to 6 hours. That within, about 90 minutes, 120 minutes, my blood sugar levels are back down into a normal range. And then similarly, if you're looking at the Kraft test and insulin, you would experience sort of a similar curve, a normal curve, where your 2-hour insulin is relatively on par with baseline and that those are within normal ranges. So, for us, and, even for me, I started out and I would have that bit of ice cream, and my sugars would stay high to 4 to 6 hours. And then my hemoglobin A1C, which is sort of the 120-day range of your blood sugar levels, was in that diabetic zone at the time. But now, I'm 10 years out, and my hemoglobin A1C has been way under that, around 4.7, 4.8%, which is definitely not in that diabetic range. For optimal, we like it to be less than 5.2, and then 5.2 to about 5.6 is maybe start thinking about doing some interventions. We don't want the damage to start, and then 5.6 and so on. We start labeling people as pre-diabetes, and then borderline diabetes from 6 to 6.4, and then for full-blown diabetes after that. So the marker is my glucose or my A1C marker is fine, and these periodic periods of time where I do intentionally include carbohydrates in larger quantities and carb cycle, I have the same response. I have a completely normal response. So now 10 years out, I still maintain a normal response. I might have an even more normal response than a lot of people who have never been diagnosed with type 2 diabetes. And that's what we look for in our patients or the people that we're working with, is that normal glucose response. And many of them can get a more normal glucose response compared to a lot of people out there who have never been diagnosed with diabetes in the first place.